Welcome to Emergency Insights. I'm James Carter. Today, we're discussing the evolving landscape of acute appendicitis management. For decades, appendectomy has been the undisputed gold standard, especially for complicated cases. However, the paradigm is shifting, and it's essential for us, as healthcare providers, to be aware of these developments. Emerging evidence now strongly supports non-operative management with antibiotic therapy for uncomplicated acute appendicitis. Studies are increasingly demonstrating its safety and efficacy in carefully selected patient populations. This is a significant advancement, as a substantial proportion of patients are now successfully avoiding surgical intervention, reducing the associated risks and recovery times. However, it's crucial to understand the clinical considerations. While non-operative management offers a promising alternative, we do see reported recurrence rates with conservative management. Furthermore, the presence of fecaliths on imaging is a key indicator associated with an increased risk of non-operative management failure. Therefore, patient selection is absolutely critical for optimizing outcomes. Our clinical decision-making process must evolve to incorporate this new evidence. Shared decision-making is paramount. This involves a comprehensive discussion incorporating individual patient factors and comorbidities, a thorough risk-benefit analysis of both surgical and conservative approaches, and critically, patient preferences and values. Imaging findings, particularly the presence or absence of a fecalith, play a significant role in guiding this discussion. In summary, the treatment approach for acute appendicitis should be highly individualized. It must be based on a meticulous evaluation of the clinical presentation, detailed imaging findings, and a patient-centered discussion of all available therapeutic options and their associated risks. This ensures we provide the most appropriate and effective care for each patient. That's all for this edition of Emergency Insights. Thank you for joining me. I'm James Carter, and I look forward to our next discussion.